Welcome to Lecture 10 in the anatomy of the upper limb. Now we're going to progress from muscles that are acting at the pectoral girdle to muscles that act at really a major synovial joint of the upper limb. And this will be muscles that are acting at the shoulder joint, which will be a joint formed, as we will see, between the head of the humerus and a shallow depression on the scapula called the glenoid fossa. So, what is the true shoulder joint? We've already alluded to it in a previous conversation, but let's look at it in some detail. The true shoulder joint is a joint formed by the head of the humerus, there's the humeral head right there, and a shallow depression on the lateral aspect of the scapula called the glenoid fossa. Collectively, as we say on this slide, this articulation forms the true shoulder joint, or the glenohumeral joint. And this articulation is what we call a ball and socket joint, where literally we kind of have a shallow depression that obviously acts as a socket and a ball-like prominence on an adjacent bone where we form a reasonably secure articulation. But the term reasonably secure is obviously illustrative because the depression on the scapula is relatively shallow and the head of the humerus nowhere near fills up the entire space of the glenoid fossa. The word fossa in anatomy means a shallow depression. So this ball and socket joint is one at which we have movements that are possible in all three of the cardinal anatomic planes. We will have a series of muscles that will flex and extend the arm at this joint, moving it in the sagittal plane. We will have a series of muscles that will move the arm in the coronal plane and muscles that will move it in the horizontal plane, and we'll define them in due course. So note that this is a relatively insecure joint in that, aside from the fact that it is a ball and socket joint, the joint itself has sacrificed stability for mobility. So we have a tremendous what we call range of motion of the actions that are possible in this joint because we want to be able to move our arm and therefore the rest of our upper limb in various planes to manipulate object in space. Everything from hurling a baseball or a football to swinging a golf club or performing everyday actions such as reaching for a jar of spaghetti sauce on our pantry shelf. So the head of the humerus basically is forming a ball and socket joint with the glenoid fossa of the scapula. So let's look at the movements that are possible at this joint, but before we do that, some of the major muscles that act at this joint will be what we will identify a little later as the rotator cuff. And the rotator cuff muscles, if we spell out the first letter of the four muscles that make it up, they spell out a mnemonic word, a device for remembering the name of the muscles, that spells out the simple word sits, S-I-T-S. And the four rotator cuff muscles, as the name sort of implies, are going to act to rotate the arm at the shoulder joint. That will be true actually of 3 out of 4 of them, but we'll talk about them in a minute. So the four rotator cuff muscles are supraspinatus, a muscle named because it lies in a shallow depression superior or above the spine of the scapula, which I'm outlining in blue. An infraspinatus, named because it occupies a shallow depression below or inferior to the spine of the scapula. A teres minor muscle, which you can just barely see. The word teres means round. So if we were to cut a cross section through the teres minor muscle, presumably it would have a round profile. And then on the anterior aspect of the scapula, we will find a subscapularis. So these muscles, as their name implies, are acting as rotators of the arm at the shoulder. But they play a much more equally important role in stabilizing the shoulder joint because the tendons of the four rotator cuff muscles pass in close proximity to the shoulder joint itself and strengthen the articular capsule at a joint that, as we said, has sacrificed stability for mobility. So these muscles and their tendons tend to prevent humeral dislocation or a shoulder dislocation because they strengthen the superior aspect of the joint with the supraspinatus tendon, the posterior aspect of the joint with the infraspinatus and the teres minor, and the anterior aspect of the joint with the fibers of the tendon of the subscapularis. So by virtue of this conversation, where is the weakest point of the shoulder joint capsule? Inferiorly. So when you dislocate your shoulder, you are causing literally or causing an injury, usually associated with trauma, that depresses or pulls or pushes the head of the humerus out of its articulation through the inferior aspect of the joint, which is the weakest part of the joint because that's the only part of it that's not being strengthened by a component or a tendon of the rotator cuff. Okay, so what are the actions? We've already alluded to them, but picture's worth a lot more. Here are the actions possible at the shoulder joint. We have the ability to flex and extend the arm at the shoulder. There's the joint where this action is occurring. So we're going to need muscles to do that. Basically, that's occurring in the sagittal plane. Then when we move the arm in the coronal plane, we are moving it away from the midline axis, or returning the arm and the rest of the upper limb to the anatomic position by adducting it. And then we also have the ability of changing the position of the midline axis going through the anterior aspect of the arm by rotating the arm medially by moving that anterior axis toward the body wall, or by moving it laterally by moving the anterior midline axis of the arm, basically, and rotating it in a horizontal plane away from the body wall. So we're going to need some muscles that perform those actions as well. And if we kind of combine adduction, flexion, and extension, we basically can perform a series of all of those actions, perform one after the other, that we would call circumduction. So first off, let's look at a corresponding chart of actions that occur at the glenohumeral shoulder joint, and you can see we've grouped them into 6 groups. But basically, we've grouped them again into antagonistic pairs. We have muscles that will flex and extend the arm at the shoulder, ab and adduct in the coronal plane, and laterally medially rotate. So who are going to be the major flexors and extensors? They are going to be large muscles that have broad attachments to the anterior or posterior aspect or cross the anterior posterior aspect of the shoulder joint. Because muscles, by definition, that cross the anterior aspect of a joint have the capability of flexing at that joint, because flexion occurs more or less by moving anterior body parts closer together for the most part, whereas extension, in this case of the arm at the shoulder, is going to basically move the arm in the sagittal plane in the posterior direction. So what's going to play a major role? Muscles on the anterior chest wall and muscles on the anterior aspect of the arm. So we're going to utilize mainly the clavicular fibers of the pectoralis major, the anterior or clavicular part of the deltoid. Those are chest wall muscles that attach broadly to not only the clavicle, but also, in the case of the deltoid, to the scapula. And also 2 anterior arm muscles that also have attachments to the scapula that blend down onto the anterior aspect of the humerus. Then on the extensor side, we're going to use fibers on the other side of the deltoid. And when we look at the deltoid being a very broad muscle that adds really mainly to the bulk of the shoulder, we're going to see that its posterior fibers are in a position to extend the arm at the shoulder, as are the fibers of a latissimus dorsi that we've seen previously, and the teres major. But again, look how precise this is. It wasn't as precise or as simply put when we looked at pectoral girdle muscles, but look at what is going to be the dominant source of innervation that is going to be found in virtually every nerve which is acting to flex or extend the arm at the shoulder, C5 and C6. But note, not one single nerve at any of these joints or any of these actions is the sole controller of that action. And we kind of saw this when we were moving the pectoral girdle as well. Certainly the pectoralis major is going to be innervated by a pectoral nerve lateral. The axillary nerve innervates all parts of the deltoid, but the musculocutaneous nerve, our major innervator of anterior arm muscles, is innervating the short head of the biceps, excuse me, as well as the coracobrachialis. Now, so let's look at the major players. Here we see the clavicular fibers of the pectoralis major, not to be included with the sternocostal fibers, which are more active in playing a role in adduction of the arm at the shoulder as well as medial rotation. So those clavicular fibers are more in a position to flex the arm at the shoulder, as are the clavicular fibers or the anterior fibers of the deltoid, as we see here. But then assisting these muscles on a much deeper plane are the two components of the biceps brachii, both of them. Note that the biceps literally means a muscle that has two heads, and both of the heads of the biceps have scapular attachments, and therefore both of the heads of the biceps must cross the anterior aspect of the shoulder joint, and following that rule they must act on the shoulder joint by acting as flexors of the arm at that joint by moving basically the humerus. So these components are a short head of the biceps brachii that attaches to the coracoid process, and a long head of the biceps. It's not labeled on here. This is the long head. The long head of the biceps attaches to a small elevation just above the glenoid fossa that's called the supraglenoid tubercle. Remember, the basic reason that muscles have bumps, bulges, tubercles, tuberosities is to provide attachments for skeletal muscles. So these two heads of the heads of the biceps brachii also are flexors of the arm at the shoulder, as well as is the so-called coracobrachialis, a muscle that also arises from an attachment to the coracoid process, I should say proximal attachment, and extends down to attach broadly to the midshaft portion of the humerus. And again, its fibers are largely running parallel to the short head of the biceps and will act as a flexor of the arm at the shoulder. So we really have four muscles that are performing this major action, because largely when we move the arm in a flexed position, we are moving it against gravity. So then what are the muscles that are acting as extensors of the arm at the shoulder? Now we move back to the posterior chest wall, and we're looking at the posterior fibers of the deltoid, which are attaching broadly to the scapular spine. And we're also going to utilize the fibers of the latissimus dorsi and the fibers, even though it's not labeled here, of a muscle called the teres major. The teres major and the latissimus dorsi have actions that are very similar to one another because they share a similar attachment on the anteromedial aspect of the humerus, so they're in a very good position to pull the humerus in the sagittal plane posteriorly, as are the posterior fibers of the deltoid. Also, certainly in a good position to extend the arm at the shoulder will be just one of the heads of the triceps brachii. Word brachia means arm. So the word triceps certainly means that this muscle has three heads, but only one of the triceps heads actually crosses the shoulder joint. and it's the long head of the triceps, and it attaches to the infraglenoid tubercle of the scapula. So it's kind of analogous but antagonistic to the long head of the biceps brachii that attach to the supraglenoid tubercle of the humera of the scapula, and obviously being on the posterior aspect of the joint, it's going to have an antagonistic action at that joint. Now let's use our digital atlas to view the contracting muscles that are flexing or extending the arm at the shoulder. And certainly, as we've already indicated, our flexors are found on the anterior chest wall or the anterior aspect of the arm. And here again, we are seeing what's illustrated here, the entire fibers of the pectoralis major, but as we've indicated, it's those clavicular fibers that are really in a better position to act as flexors of the arm at the shoulder. But here we do get the individual anterior fibers of the deltoid. Just those fibers that are attaching to the lateral aspect of the clavicle are in a very good position to act as flexors of the arm at the shoulder. Note that we're not including the fibers of the middle deltoid. The middle deltoid, as we'll see in our next lecture, will be playing a major role in abduction of the arm at the shoulder. And then, not to be left out, we certainly see here the fibers of the long head of the short head of the biceps brachii, the more medial fibers, and the fibers of the long head of the biceps brachii performing a similar action. And if we rotate this around to the back side, you really can't see well the fibers of the coracobrachialis, except there it is. There are the fibers of the coracobrachialis, which we couldn't see well from the anterior side, but we can certainly see a little better from the posterior side because those fibers are largely hidden by the remaining short head of the biceps, with which it is sharing an attachment at the coracoid process of the scapula. Now, if we look at the companion muscles, the muscles obviously that are capable of extending the arm at the shoulder, and obviously we'll make the comparison going forward. So here are the muscles which are going to extend the arm at the shoulder, and again now you can see a very good illustration of the posterior fibers of the deltoid performing the antagonistic action to the anterior fibers of the deltoid, and as we've already indicated, you can see that the extension of the arm at the shoulder is being assisted by the fibers of the teres major, the fibers of the latissimus dorsi. Note that despite the size differences between these two muscles, they basically are going to act basically in a similar fashion. And lastly, as we've already indicated, the other extensor of the arm at the shoulder is our long head of the triceps. So again, you can see all of these muscles performing a corresponding series of actions. There again are the posterior fibers of the deltoid, the fibers of the long head of the triceps, and the fibers of the teres major, and the fibers of the latissimus dorsi performing actions that extend the arm at the shoulder, basically in a position, putting it back in the anatomic position or pulling it more posteriorly, and certainly act as antagonists to the muscles that are acting to flex that we previously described.